Hey guys, welcome to our video today. The channel is Future Talks. My name is Vincent. Today I want to welcome you to a very interesting aspect on matters reproduction. Today I'm going to talk about something very important called ovulation. I don't know if you know about it. I want to give you a very interesting fact. The longest recorded time between birth of twins is 87 days. This unusual case occurred when a woman in the UK gave birth to premature twins, and the second twin was born nearly 3 months after the first. This is an extremely rare occurrence and testament to wonders of modern medicine in helping premature babies survive and thrive. Think about it. Guys, welcome. Kindly, if you have not subscribed to Theatre Talks, I want to welcome you to our video today. Kindly support us, and also kindly, if you have subscribed, we want more time on watching these videos. Kindly watch that video, but also share with your friends so that that's the best way you can always support us. On ovulation is a crucial part of menstrual cycle, like we know. And when we talk about ovulation, we mean releasing of an egg in the female. And we know the eggs are released from the ovary. And this typically occurs in the middle of a woman's menstrual cycle around the 14th day, although it can vary from person to person also. So depending on one's menstrual cycle, but it is expected on the 14th day. If you have that's when you have a cycle of around 28 days. So it's most of the time expected of you that you experience this ovulation on the 14th day. And on the facts about the ovulation, it typically occurs in the middle of a woman's menstrual cycle, like I've said, around the 14th day, although it can also vary from one person to a person. Hormones, particularly the luteinizing hormone, that's a special hormone. It's called also LH, and also the follicle stimulating hormone, or the FSH, plays a very significant role in regulating the ovulation. Ovulation is influenced by various factors, including stress, illness, and also changes in weight. So, there are other factors you consider when you talk about ovulation and also the date of ovulation. So, factors such as stress, like when one is undergoing a lot of stress, maybe someone has exams, maybe somebody has lost their loved one, maybe somebody has been involved in a very strenuous exercise, maybe one is especially involved in intense exercise for competition, like in athletics. So ovulation is also affected, and also changes in weight also. If you gain a lot of weight suddenly, if you lose your weight suddenly, it also affects your ovulation. Also, the ovulation is influenced by various factors, including stress, illness, and also the change in weight, like I've said. The released egg travels into the fallopian tube where it can also be fertilized by the sperm. So the main ovulation is the main factor which controls how one conceives. It helps, or it guides on how one gets to conceive. So with the traveling of the egg to the fallopian tube, it goes there and chills to wait for the sperm to come there for conception to take place. So normally in normal pregnancy, the conception takes place in the fallopian tubes. Though we have sometimes when we have those abnormal kind of fertilization taking in other parts of the body, where now one develops to what we call the pregnancy on the tubes or somewhere else, where now we call that one ectopic pregnancy. Ovulation can cause physical symptoms in some women, such as abdominal discomfort or change in cervical mucus consistency. So, and I'm choosing my words very skeptically. In some women, who may experience abdominal discomfort or abdominal pain, and also change in the cervical mucus consistency. So these things are perceptive on individuals, and it varies from one lady to another one. So it all depends on you, on your own experience, and those people don't experience much of that. Those who at that time they feel a lot of maybe the temperatures of the body rise to a certain level, or they don't feel anything at that kind of a level. So tracking your menstrual cycle and using ovulation predict can be a good predictor to help you when ovulation is likely to occur. So, like I said, if your menstrual cycle is for 28 days, you're likely to ovulate on those towards the 14th day, and because of the certain changes which you monitor in your body. So during ovulation, like is well known, that is when one is likely to get pregnant, because and that is the most fertile days in the lady's cycle or a woman's cycle, making it the prime time for conception. Though also a fact about ovulation is that birth control methods like the pill, IUCDs, and implants can prevent ovulation as a means of contraception. So birth controls normally what they do, like the pills, especially the hormonal family planning methods. What they do, they interfere with the process of conception, and also they interfere with the process of ovulation. So if ovulation is disturbed, now conception becomes an issue there, and that is how one comes out to prevent the pregnancy. So understanding your ovulation pattern is essential, guys, especially the ladies and also the men, for family planning, and can help also diagnose fertility issues if conception is difficult. So normally your doctor will always advise you on how to monitor your fertility days and how to go about them, so that you get the kind of expected help through diagnosing your ovulation and also the menstrual cycle trends. So, guys, remember that every person's menstrual cycle is unique. So, it is essential to track your own cycle and consult with your healthcare provider for personalized advice and fertility. So, that is very important. So, guys, on additional information on the ovulation. So, ovulation, I've mentioned about luteinizing hormone. Ovulation is triggered by surge or high levels of luteinizing hormone, which causes the mature follicles to release the egg. So, the luteinizing hormone, it's a special hormone in the female. This is the one which really helps in the release of the egg. So, with the when one approaches the 14th day of the cycle, we're talking about the cycle of 28 days, halfway in your periods. So you expect that the hormones go high and they bring a lot of changes in the female body. So at that time, that's when the egg is released from the ovary to the fallopian tubes. So the lifespan of a released egg is relatively short, typically around 12 to 24 hours. So sperm, on the other hand, can survive in the female reproductive tract for up to 5 days, so increasing the fertility window. So a fact here is that the egg of a lady or a woman is likely to survive for 12 to 24 hours, But the sperm, on the other hand, can survive in the female reproductive tract for up to 5 days, increasing the fertility window. So this is where now the doctor comes in to advise the couples who want to conceive and are having the challenge to conceive, or the people who want to conceive, to increase their frequency of sexual activity towards this time to ensure the conception takes place. Ovulation can sometimes be accompanied by mild abdominal pain or discomfort. Often it's referred as the Mitchell Scammers period, where one experiences some abdominal pain or discomfort. Is a common thing which uh, a larger population of the ladies complain about during this period of ovulation. So stress and certain medical condition can also disrupt the ovulation regularity. So some signs of impending ovulation, how can one know that one is undergoing ovulation? You find that we have what you call cervical mucus production, where now a lady experiences a lot of discharge from the vaginal area. There is an increase in the production of the mucus in that area. Another thing is higher basal body temperature. The temperature of the body rises up, and also at this time the libido of the lady also is heightened, or they have a heightened sexual desire at that particular time when one is ovulating. Tracking the menstrual cycles and monitoring ovulation can be helpful for both avoiding and also getting pregnancy. So we don't look on only getting pregnant, but also we look at one of avoiding to get pregnant. So such that when one experiences this kind of situations, if one wants to conceive, one can now take a step and avoid the sexual intercourse when not expecting to conceive. And when expecting to conceive, that is the time to maximize the sexual activity so that it increases the chances of one getting pregnant. Hormonal birth control methods such as pill can suppress the ovulation, and we found out that the most of the family planning methods with the hormones, uh, which have hormonal content, they suppress or they interfere with the ovulation process, hence interfering with the conception. Some women may experience irregular ovulation, which can make predicting days more challenging. So it is a fact that, especially there's a part of a larger part of the population which experience this kind of a thing, where now because they can't because of the irregularity of the periods and the irregularity of the ovulation, so you can't really predict when one is ovulating and when one is likely to be fertile days. We have what we call ovulation predictor kits or OPKs, which can be used to detect the rise of the luteinizing hormone or the surge of the luteinizing hormone, and which also help to pinpoint the most fertile days in the menstrual cycle. Because if one wants to conceive, especially if the lady wants to conceive, it is very important that when the egg is released from the ovary to the fallopian tubes, the lady gets to conceive, the sperm gets to the egg within the 12 to 24 hours. Because after 24 hours, you find that now the egg is not viable from the lady. But we found out that the sperm can really stay up to 5 days or can survive up to 5 days. So the frequency there, and also with the surge of luteinizing hormone, it is a good predictor for the ladies that now those are the fertile days, and knows how now to get the pregnancy or to avoid the pregnancy at a particular moment. So understanding your pattern can also be valuable diagnosing and also treating certain reproductive issues like in what we call PCOC or polycystic ovarian syndrome. We will deal with that at a particular point. It's very important that you get to understand your pattern so that you predict, especially reproductive issues like what you call PCOC or polycystic ovarian syndrome. Remember that while these facts, general information about ovulation, uh, individual experiences may vary, and it is essential to consult with the healthcare provider with a personalized guidance on reproduction, health, and family planning. Guys, in conclusion, ovulation is a critical and fascinating aspect of the menstrual cycle for individuals of reproductive age. It involves the release of mature egg from the ovary, typically occurring in the middle of the menstrual cycle, and hormonal changes, physical symptoms, and also various factors influence the ovulation. So, understanding one's ovulation pattern is essential for family planning, and also the fertility assessment and the reproductive health management. Tracking methods and healthcare guidance can help individuals make informed decision about the reproduction, so that one gets to get to birth control and also gets to conceive. Ovulation looks very simple and also very straightforward. I know back in high school, back in even our primary school, and also here in Africa, even the CBC classes, that's competence-based curriculum, which was introduced recently. The kids are taught about these things, about especially menstrual cycle, because also they are taught about the menstrual hygiene. So the kids are taught on how, especially the girls and the boys, what they expect to change in their body during particular times, so that they know if they're expecting to get to the periods or what is the changes which are happening. So it's very important that ovulation is really understood very well, because it controls fertility of a girl, and also especially for the ladies who have issues with conception. Ovulation is a very critical thing which one should understand and know very well on how to time. Especially we've talked about the kit which one can use to detect the surge of the luteinizing hormone, which really controls the release of the egg from the ovary. And also we talked about FSH, follicle stimulating hormone, which stimulates also the egg production in the ovary each month. And also it's a very interesting process which takes place in the ovary to release that egg to the fallopian tubes, and also for conception to take place, how the sperm also gets to the fallopian tubes, and also for the lady to get pregnant. However, as much as we say about ovulation, the man doesn't ovulate. We also have issues with men and also with the health of the sperms. Sometimes the lady may be ovulating very well and also with the hormones very well balanced, but you get that there's a challenge where now the man produces doesn't have the healthy, what we call healthy sperms, to make the to fertilize the egg so that the lady becomes pregnant, or there is a reproduction there. So it is very important when one wants to get to conceive, especially the couples who have a challenge of conceiving, to get to the healthcare provider, because also there are some tests which can be done on the lady and also at the same time for the man, because with the trends we have, also men have great challenges with their sperms and also with their reproduction. So that the semen analysis is done in a particular way, so that you get to find out where the challenge is. So it is not a lady issue about, especially when we talk about infertility. And kindly, if you have not looked at a video or watched a video on infertility, I want to encourage you to find it out here in our channel and also get to watch it. So we have infertility issues, and most of them they touch on men, but especially in an African setting, it's always a lady to blame when there is no conception at that particular time, and maybe they want a kid. The lady is always pointed to be the one with the problem. But I want to tell you, most of the time also, men, we need to accept and also go for those semen analysis and also treatments so that you may get you may get yourself evaluated so that we find out where the problem is and also solve them at that particular time. Because these kind of problems, especially related to secondary infertility, can be solved very fast so that things get moving. Guys, I want to welcome you to our channel. The channel is Future Talks. Kindly, I want to welcome you to our next video. Thank you guys and welcome.